doctor, a TV commercial, or even a neighbor at the grocery store. Just keep walking. Walking is the best thing you can do. And while walking is absolutely better than doing nothing, I want to be very honest with you today, because honesty is what actually protects your health. Walking alone is not enough to keep you strong, steady, and independent as you age. I've spent years working with older adults who walked faithfully every single day, yet still struggled to stand up from a chair, still lost muscle, still developed knee and hip pain, and still suffered dangerous falls. That's why today I'm going to share 5 simple, surgeon-approved exercises that are actually better than walking for people over 60. These movements are safe, realistic, and designed for real American lifestyles. And if you do them consistently, they can help you stay independent, confident, and mobile for years longer than walking alone ever could. Let's start with a truth that most people are never told. After the age of 60, the biggest threat to your independence is not heart disease alone, and it's not getting older itself. The real danger is muscle loss, joint instability, and balance decline. In the US, falls are one of the leading causes of injury-related hospitalizations for adults over 65, and many of those falls happen to people who consider themselves active because they walk regularly. Walking is a straight-line, repetitive movement. It does very little to maintain muscle strength, bone density, or balance once your body adapts to it. What you actually need are exercises that train your body to handle daily American life, standing up from soft couches, climbing stairs in split-level homes, stepping off curbs in parking lots, carrying groceries from big-box stores, and moving confidently in crowded places. That's exactly what the exercises we're talking about today are designed to do. The first exercise is one of the most powerful movements for aging adults, and it's something you already do every day whether you realize it or not. It's the sit to stand. This movement trains your legs, hips, and core, and it directly determines whether you can live independently. Think about how often you sit down and stand up in a typical day. Getting out of bed, standing from a dining chair, rising from the toilet, getting off the couch, or standing up at a restaurant booth. When this movement becomes weak, everything else becomes harder. To do this exercise, sit in a sturdy chair with your feet flat on the floor, about hip-width apart. Sit tall, lean slightly forward from your hips, and press through your heels as you stand up. Then slowly lower yourself back down with control. That slow lowering is just as important as standing up because it strengthens your muscles and protects your knees. If you need to use your hands at first, that's fine. Over time, try to rely on them less. This single exercise strengthens the exact muscles that prevent falls and joint pain and is far more effective for daily function than walking around the block. The second exercise focuses on balance, which is something walking does not adequately train. Balance is not just about your legs, it's about how your brain communicates with your muscles. In the US, many older adults lose balance confidence long before they actually lose balance ability, and that fear leads to less movement and more stiffness. Single leg standing is one of the simplest and most effective ways to protect yourself. Stand near a kitchen counter, bathroom sink, or sturdy chair. Lift one foot slightly off the ground and hold that position. Keep your chest upright and your eyes forward. Start with 10 to 15 seconds and gradually build up. Switch sides. If this feels too easy over time, reduce how much you hold on or gently turn your head side to side. This exercise strengthens the small stabilizing muscles in your ankles, knees, and hips and dramatically reduces fall risk. Walking keeps you moving forward, but life rarely happens in a straight line. Balance training prepares you for real-world movement. The third exercise addresses a major weakness I see in many American adults over 60. Upper body strength. Many people assume that as long as their legs are moving, their upper body doesn't matter. But upper body strength is essential for pushing doors, bracing during a stumble, lifting laundry baskets, carrying groceries, and even getting up off the floor if you ever need to. Wall push-ups or counter push-ups are an excellent, joint-friendly option. Stand facing a wall and place your hands at shoulder height. Step your feet back slightly so your body forms a straight line. Slowly bend your elbows and bring your chest toward the wall, then push back to the starting position. Move slowly and with control. If the wall is too easy, use a kitchen counter or sturdy table. This exercise strengthens your chest, shoulders, arms, and core without stressing your joints, and it supports good posture, which helps reduce neck and shoulder pain that many people mistakenly accept as normal aging. The fourth exercise focuses on the hips and the ability to move backwards safely, which is something walking almost never trains. Many falls happen when stepping backward, such as when backing away from a sink, stepping out of a car, or adjusting position in a crowded space. Controlled step backs are incredibly valuable for this. Stand tall and hold on to a chair or counter if needed. Step 1 foot straight back and gently bend both knees just slightly, then push through your front heel to return to standing. Keep the movement slow and controlled. You're not trying to go deep, you're training stability and strength. This exercise strengthens your hips, thighs, and glutes, which protect your knees and lower back. It also improves coordination and confidence during backward movements, something that walking simply doesn't address. The fifth exercise may not look impressive, but it is critical for long-term mobility and comfort. Gentle spinal rotation. Many Americans over 60 spend long periods sitting, driving, or moving in one direction, which leads to stiffness in the spine. This stiffness affects balance, posture, and even breathing. To perform this movement, sit or stand tall and gently rotate your upper body to one side, keeping your hips mostly still. Go only as far as feels comfortable, then return to center and rotate to the other side. Move slowly and breathe naturally. This keeps your spine flexible, improves circulation, and helps you maintain the ability to turn your head while driving, reach into cabinets, and move without stiffness. Walking does very little for spinal mobility, which is why many daily walkers still feel tight and restricted. At this point, many people ask, should I stop walking? The answer is no. Walking is still beneficial for heart health, blood sugar control, and mental well-being, but walking should be treated as a supplement, not the foundation of your movement routine. These 5 exercises address strength, balance, coordination, and mobility, which are the true pillars of independence after 60. Just 10 to 20 minutes a day of these movements can deliver benefits that hours of walking alone cannot. There are also a few important safety principles to keep in mind. First, never rush these exercises. Slow, controlled movement builds strength and protects joints. Second, avoid pushing through sharp pain. Mild muscle effort is normal. Joint pain is a signal to adjust. Third, consistency matters more than intensity. Doing these exercises a few times a week for months is far more effective than doing them aggressively for a week and then stopping. Many of my patients are surprised at how quickly their confidence improves once they practice these movements regularly. Fear is another major issue I want to address. Many older adults in the U.S. limit their movement because they're afraid of falling or getting hurt. Ironically, avoiding movement makes the body weaker and increases risk. These exercises are designed to rebuild trust in your body. As your strength and balance improve, your fear naturally decreases. You start moving more freely, standing taller, and engaging more fully in life. That confidence is just as important as physical strength. Imagine being able to stand up from a low couch without struggling, climb stairs without gripping the railing, carry groceries from your car without shoulder pain, and turn quickly without feeling dizzy or unsteady. This is what functional exercise gives you. Not extreme workouts, not complicated gym routines, but simple, targeted movements done consistently. This approach is realistic, safe, and sustainable for American adults over 60. As we come to the end, here's what I want you to remember. Aging well is not about doing more exercise. It's about doing the right exercise. Walking is good, but it is not enough. Sit-to-stands, balance training, wall push-ups, controlled step-backs, and gentle spinal rotation work together to protect your muscles, joints, and independence. These are the movements that help you stay in your home longer, avoid injuries, and enjoy life on your terms.